अस्सलाम वालेकुम एवरीवन। सो आज हम बात करेंगे कि हाउ शुड यू प्रिपेयर फॉर योर फर्स्ट कीमोथेरेपी सेशन। आई नो कि जब भी कैंसर डायग्नोसिस होता है और आपको ये ट्रीटमेंट एडवाइस होता है तो आपको बहुत एंग्जाइटी होती है, बहुत ज़्यादा आप ओवरवेलम्ड होते हैं क्योंकि इन्फॉर्मेशन इतनी सारी आ रही होती है। इट इज़ वेरी हार्ड टू ग्रैब एवरीथिंग। सो दिस इज़ व्हाट आई सी इन द क्लिनिक कि जब हम फर्स्ट साइकिल पे पेशेंट से डिस्कशन कर रहे होते हैं तो मोस्ट ऑफ देम दे आर नॉट अटेंटिव, दे डोंट रजिस्टर द इन्फॉर्मेशन जो हम उनको दे रहे होते हैं. So I decided to make a short message so that people can listen to it again and again, so that you don't forget the necessary details जो कि आपको कीमोथेरेपी के डे पे एडवाइस होती हैं. So first of all, you have to book an appointment with the chemotherapy daycare, which means कि majority of the good centers they have chemotherapy booking system. So if you have been advised chemotherapy, so you need to book your appointment for chemotherapy administration with the chemotherapy daycare or with the chemotherapy ward. So once you have done that, so remember that you have to see your doctor on the same day as you are having chemotherapy, which means that you have to see a doctor on the same day. So you have to book an appointment with the doctor as well. That should be at least 30 minutes to 1 hour before chemotherapy administration time. So on the day of chemotherapy you will first see the doctor and then go to the chemotherapy administration area. So first of all, you should know that for every chemotherapy cycle we need recent blood test, which means that you have to do your basic blood test, which includes CBC, creatinine, LFTs, so liver function, kidney function tests. So these are simple basic blood tests which are done before each chemotherapy cycle. And remember, test या तो एक दिन या फिर 2 दिन पहले होने चाहिए. So chemotherapy can affect your blood count, so it is very important to monitor your basic blood counts, and then it can affect kidneys and liver, so we need to frequently monitor your kidney and liver function tests. There are certain requirements which are different for each chemotherapy, like you need a heart ultrasound before certain chemotherapy. Then there are certain patients who are diabetic, who are hypertensive, who have heart disease, so sometimes we do refer them for a heart ultrasound irrespective of what chemotherapy we are giving. So some patients need additional investigations depending on their type of chemotherapy as a standard. They may need additional blood tests depending on their type of chemotherapy. So for patients who are having immunotherapy, we need to check thyroid function test, cortisol levels. So it varies from chemotherapy to chemotherapy, but you should be having this in your mind that for each chemotherapy cycle you need to have blood tests. बहुत लोगों का क्वेश्चन यही होता है, can you eat during chemotherapy? So yes, you can eat, drink during chemotherapy. You can have your breakfast on time, and you can